Hey, welcome to PHI and PPE. I'm Deanna Otts-Whitfield and my co-host Amy Wood. We're from Copper Penny Consulting, and I have a question for Amy today. Amy, so yesterday I was practicing in a dental office, and my patient was my husband, and I now we're in the same family profile as far as dental charts go, and I was his provider yesterday, and we have also disclosed that we're each other's HIPAA contact person. But what happens in those situations where maybe additional family members come in and you don't have you're not that HIPAA contact person for their charts, but Aunt Sally wants to know how Bobby's doing with their home care. Or, Grandfather Mac, asked what's going on with his granddaughter's wisdom teeth. How do you handle those situations, even though they are family members? Or if the provider is a family member, but they shouldn't be talking about that to other family members. Just walk me through that because I almost thought about calling you yesterday.
You should have. That's what I'm here for.
I was busy. I didn't even have time to pee until 5 o'clock. The
Isn't
life of a the life of
isn't
a
that a
hygienist.
common thing though?
You think, but yes, it is. Okay.
So I kind of think of it as you have to wall things off and you have to compartmentalize things mentally. So even though they're your family, inside that office, the second you step foot in there, they are a patient and all the HIPAA rules apply. And I know, especially in small towns and family-centric businesses, it makes it really difficult, but you have to just, keep your trap shut. Like one of my teenagers says, zipper your lipper.
I
Less
like
is
that.
more. I know, isn't it great?
It is cool.
She says I'm too old to use it, but
Oh,
um,
please.
I keep telling her, I'm technically a millennial. I can say
Yeah, you
it.
made her. You made her. You
No.
can say whatever she says.
She's like, you wear skinny jeans and a side part. I don't think you can say anything. I'm like, hey now.
They're still saying that. That was like so like 2024. Anyways.
So anyway, you have to compartmentalize these topics. So let's put it in a different context. What if it were an ex or a neighbor you can't stand that's sitting in your chair?
Exactly.
Like you have to be a professional. You don't do more than the minimum necessary in their chart to do your job. So you don't go snooping around in their records, find out, if they had to get care credit because their finances can't afford to pay out of pocket, or if they have crappy insurance, or what the issues are there. So, um, you know, being able to compartmentalize that is key. Now, with you treating your husband, I'm sure you were an exceptional professional, and
Mm-hmm.
you might have given a snide comment or two about his flossing habits, which you can't say anything. But that response, just the, that's not a yes or no. It's non-committal,
Mm.
and that tends to work the best when you're dealing with situations like that. So, um,
So
yeah.
if that patient gets upset, can you just say something to the effect of, well, maybe you should go ask your sister how her home care is, or I am unable to disclose those details, or what's a good way of putting it to someone that maybe you're really close to and they're expecting you to answer because y'all are friends or family members, but you don't have a right to do so.
Yeah. So, I mean, I'm brutally honest. My husband calls it the punch in the throat approach to life,
Mm-hmm.
and that's how I verbally communicate with people. I just say it like it is. And
Yeah,
sometimes it's rough, and I've had to soften that.
sure.
So, I tend to be very blunt and just say, "Oh, I can't talk about that here. I'd lose my job. You don't want me to lose my job, right?"
There you go. I like that. Yeah, kind of put it back on them in a way.
And it's still kind of joking. You do it with a smile and you let them know, like, hey, they're a jerk for asking.
Yeah,
And they
true.
might not know, they might
True.
not understand. I've also seen it where um, people will recuse themselves from that care. They'll ask someone else in the
Mm,
office to cover for them, or they'll see someone on the schedule and be like, I should not be seeing them. Can we
yeah,
switch?
yeah,
Or
yep.
just let the office manager or the doctor know what's going on, and that tends to help too. Just de-escalating situations is kind of the name of the game for 2026.
Yes, I like that. De-escalating the situations.
De-escalation, yeah.
Yeah, that's a tactic.
Woosa.
Woosah. Everyone take a deep breath. Oh my goodness. Well, I'm really glad that I mean, I knew I was in the right because we are each other's, disclosing partners when it comes to HIPAA practices, but it just got me thinking about other providers that work on other family members or, whatever the case may be.
Yeah. No, it's an excellent question, and it's something that comes up in every single practice.
Yeah. Yeah. Yep.
All right.
Makes sense.
Well,
Well,
that's our tip for the day. That's our conversation. So hang tight for more of these in-depth topics and explanations and the how and the why and the what and the who and the what's it and the was it the candle in the library and who knows what it's going to
yep.
be.
Who
So
knows?
stay tuned for our next episode.
Yeah.
Thank you for joining us. For more information, please go to www.copperpennyconsulting.com. Bye.